Uhuru Muigai Kenyatta. He's been inaugurated for second term in office earlier today. Earlier on in his inauguration speech, he focused on a 50% cut in power tariffs for manufacturers during off-peak hours. And it was one of many policy ideas that he pitched then. He said his administration will target job creation by focusing a lot more on manufacturing. The government intends to focus on developing subsectors like agro-processing, textiles and apparel, leather processing, construction, materials, innovation and IT, mining and extractives too. President Kenyatta also announced that anyone in Africa will now be able to get a visa on arrival right in Kenya. Now that change in policy is meant in part to spur intra-African trade and tourism. East Africans on their part now, they can settle and trade in Kenya without any restrictions at all. So then, let's dig into the speech made by the country's president a little earlier today. David Owero is an economist who's long covered the macroeconomic developments in the East African economy. He joins me now in studio. Thank you very much.
Thanks.
So we've heard quite a bit on domestic foreign policy targets, but let's start with that one about visa on arrival for a lot of Africans, because that to me sounded like a sort of stimulus package in everything but name.
Yeah, it is, because if you look at the way Nairobi tries to position itself as a regional hub, so you've got flights coming in, but also a logistics and conferencing venue for lots of the conferences that happen within Africa, that will put a big incentive for, the tourism, conference tourism, for instance, but also investors who are interested in doing business in Kenya. So that definitely is, a huge stimulus.
Right. There was also something else that he mentioned, housing. He said, and this was a line that was really interesting, I want to create 500,000 new homeowners in my second term in office. But our housing deficit is huge. It's 200,000 units a year. I mean, compared to that, that's a very feeble target.
It is. It is. I think for me, I would be more interested in hearing how, what particular segment he intends to prioritize rather than the numbers, because the numbers are, even a little is one step in the right direction. But I'm interested in hearing what the policy priority will be in terms of a focus, because we know that for low income earners, there's a big problem in Kenya. Most of the housing is for the middle income and especially the upper crust of the middle income. And so a lot of people miss out of affordable housing. So
but it's not just a capital problem, is it? Because, I mean, other than the fact, obviously, the Banking Amendment Act, which he signed into law, has constrained access to capital. But there are a lot of other factors that also limit the uptake of, and supply of low-cost housing as well.
Yes, I mean, you find property developers mostly having to put in the utilities. So you have to do a road, you have to do sewerage connections, you have to do electricity connections and those kind of things. And so this eventually contribute to the high markup that we see in the housing pricing within, especially Nairobi. And so part of the focus perhaps for government would be in trying to provide those utilities. And the complexity of it is that you're mostly dealing with private land, privately held land. And so government can't, put in infrastructure for, privately held lands. And so the policy choices has to actually be the route of getting into public-private partnerships. And so in a way try to achieve both the interest of the investor, but also the interest of government, which is interested in having people on more housing, but also this, low-income earners who actually need affordable housing.
Yeah, because the average income here is, about $500 a month. So if you're pricing anything above that, you're basically wasting your time. Another long-mentioned goal, Mwai Kibaki spoke about it, Daniel Moi spoke about it, his dad, Jomo Kenyatta spoke about it, universal healthcare. He spoke about that again today. All these presidents before him, they all failed to pull it off. What's different this time?
Our healthcare system needs major reforms, and there was a sort of a kickstart of that reform in the Kibaki years, but it never went all the way. What we have now is an institution that doesn't entirely see the vision of providing comprehensive universal healthcare, because at the moment you have sort of subscribers, and it's statutory, so everybody subscribes. But you have sort of a privilege for civil servants versus people who work in the private sector. So for instance, civil servants are covered much more deeply. I mean, they can have outpatient services, they can have inpatient services, and their thresholds are much, much higher than
and of course, there was this crazy idea to actually limit outpatient services only for a year.
Exactly, which sort of goes back to your subscription. So you subscribe for about Kenya shillings 6,000 a year, and then you get four visits a year for each are capped at $1,200, 1,200 shillings. So it's ridiculous. So you don't see the element of insurance in it. And so that sort of points to, is a symptom of what is happening, because the way they run the fund, it's actually run as a fund and not as an insurance, which is supposed to be investing in the premiums that people subscribe, so that you can have a return for which people can derive a benefit from.
But isn't part of the problem also, I mean, to pick up on what you're talking about, year after year after year, I see reports from the Auditor General pointing out that there's fiscal malfeasance from NHIF going back 5 years, 10 years, and no one's ever been held to account for it. Their costs, their running and operating costs as a percentage of premiums are insanely high compared to private medical insurance firms as well. In that sort of context, can we really be talking about universal health coverage when the vehicle for it is so badly run?
Yeah, I mean, there's a myriad of problems, and part of what you've mentioned is the systemic challenges that are inherent within the National Hospital Insurance Fund. But even aside from that, you've got the corruption aspect. I mean, the biggest story last year was in the Ministry of Health, where a big chunk of funds, which was meant for maternal coverage, was defrauded. And so, unless, and the president can act on this, because these are his so-called appointees who are partly approved by Parliament, but he can act directly because he's the appointing authority in this case. So for him, I guess we just have to see whether he'll walk the talk and the kind of reforms that he envisages to achieve this universal basic health coverage.
All right, we'll have to leave it there for the time being. But as always, David Owero, thank you for your time.